Are you having lateral knee pain with clicking or crepitus sound on your lateral side of your knee after a run, while running, or during your sports activities? Welcome back to my channel, Annie Pilates Physical Therapist. This video will be discussing about the anatomy of our knee, the iliotibial band syndrome, which is the thickening of the fascia that gets inflamed due to the weakness of your hip muscles. So get your mat ready and a bolster to stretch this thick band. If you're having knee pain after some serious workout, running, usually for runners, skiers, and those who jumps a lot, or even just people who have recent back surgery and it causes weakness on one side and you started having knee pain, then this video is for you. So let's first discuss the anatomy of the iliotibial band. It's actually a fascia, a thick ligament band that starts from the tensor fascia latae, which is the muscle that starts on the iliac crest and to the ridge. And because this band starts on the muscle, it doesn't attach on a bone or a ridge of a bone. So it starts on the muscle here in the front, and then when it goes down a little bit here, the gluteus maximus muscle, which is one of our largest muscle, also attaches to this band, and then it goes all the way down here on the outside part of your thigh, and then it starts rubbing on your lateral condyle of your femur bone. That this is usually the start of the pain because of the movement patterns when we walk, squats, or run due to the bending of your knee and extension of your hip. And then it inserts on your lateral area of the greater tubercle of your tibia bone on your leg. So just imagine how long that fascia is and how it starts on the muscles, not on the bone. So with these two muscles, one in the front and one at the back, if these two muscles are weak, what happens to this band? It becomes having more gliding through, causes a friction area on this condyle, and it ends up with inflammation and pain. Sometimes it's clicking, and also if you're standing a lot and you have improper footwear, it also causes that rubbing situation. So the first one we're gonna do is in standing. So we're gonna stand up gently from the mat. So the first stretching is the standing one. So if you're having pain on your right leg, you're gonna put it behind your front leg on your left. So when you're already in this position, it's already stretching this band. And then from this position, you engage your core muscle, you take a deep breath, and then slowly bend forward and love the stretch on your hip muscles all the way down to your IT band, keeping your balance and doing some standing exercises help your stability. And sometimes due to the weakness of your foot area, it causes this band problem also. So this is a good training for balance and proprioception. You take a deep breath and then slowly go up gently with your breaths and blow. So let's do this again. You take a deep breath through your nose, slowly lean forward, and my recommendation is do this 10 seconds hold while you're in full flexion, as long as you're not having back pain doing this with your breaths. And then slowly go up and blow, engaging your core muscles by pulling your belly button in and up. 10 seconds hold 10 times, and the next one you're gonna progress with leaning, lifting your arm up away from that side, and you can feel your balance is being challenged on your foot area and back, and hold that as well for 10 seconds hold 10 times. So this is difficult for people with balance issues, and have a few more stretching exercises we could do in side lying and sitting and back to the center. And my recommendation is to do it both sides so that you're balanced and centered. So this one could be your good side at the back. It's nice to stretch your IT band as well, and your back and your hip. Before you run today, it's best to do these exercises before you run as well as after, to keep the blood flow moving and stretching this thick ligament that gets really inflamed, and also icing the area after the run and putting some heat before your run. At least 20 minutes heat on the inflamed area, and down below, and hold it for 10 seconds. It feels a lovely stretch. And slowly go up and do it also the leaning and reaching over, holding it for 10 seconds with your breath and holding it that position, and back to the center and below 10 times as well. Now we're going down to the mat and we're gonna do a mermaid position. So in this position, this is a 90 position. So 90 degrees in the front of your hip straight, 90 in your angle in your knee, as well as at the back. So I'm targeting the IT band at the back. So I'm focusing on my right today, still 90 degree, and then you're gonna gently lift your foot up to internal. So when you do this, you're stretching and strengthening that muscle, the gluteus max, isolating near the origin of your IT band. So you take a deep breath and lift and hold it for 5, 4, 3, 2, 1. And some people with back pain issues, this is going to be difficult to sit up straight, and I have more exercises you can also try if this is too difficult. And you can do this up to 10 times as well. Hold it for 5, 4, 3, 2, 1, and then you slowly progress up to 10 times. You're trying your best not to use you're leaning forward, but trying to really lift the muscles. So if you have a lot of weakness on your hip internal rotators, so you'll be surprised that your gluteus medius, which is another muscle near the gluteus max, which is part of these big muscles bundled for squatting, the gluteus medius help internal rotates your hip. So the gluteus medius is also important to keep the IT band strong and healthy, so your gluteus max could work well during high impact activities. So lift and hold it for 5, 4, 3, 2, 1. And my recommendation is to do it both sides so you're balanced. Even though your other side is normal, it's best to strengthen evenly so you don't get problems also on the good side. So you lift with your breaths. You take a deep breath through your nose, belly button in, still engage your core, and hold it for 5, 4, 3, 2, 1, and slowly progress up to 10 seconds hold. So the next one, we're going to use a bolster, and we're going to do a myofascial release, lying on your side. So if I'm focusing on my right, so I'm just gonna go. So you've seen people in the gym doing this, and one leg up here for stability, and you glide through. If you have shoulder pain, be careful. So you go all the way down to the insertion near your knee to really rub it in. And my recommendation is to do this at least 5 to 10 minutes. Depends on your tolerance on this deep myofascial release. Just back and forth. So I'm closer to the knee area where there's more inflammation. And the next one is side lying exercises. So if I'm focusing on my right side, I'm gonna lie down on my left, and we're gonna do clamshell to target and slowly open and hold it for 5 seconds and back. And the progression in this, after 10 repetitions, and this gets easier, you grab a TheraBand or resistance bands and wrap it around your knee area, and you're just gonna open and resist it. You can also use your hand to hold it and resist the area. 5 seconds hold and back. slowly strengthening the gluteus area. And after that, you can do a PNF pattern, another great strength training program. PNF means proprioceptive neuromuscular facilitation, which is a neuromuscular re-education, because when you started limping, you're losing the flexion. You kick up with your toes pointing to the ceiling, and then you kick back with your toes pointing down the floor. So when you do that, you internal rotate again your hip, and it helps target the gluteus medius near your gluteus max, where it inserts on your IT band. So you take a deep breath and lift. Inhale through your nose, belly button in, engage your core, and then back, blow. Inhale up, belly button in, and blow. Take a deep breath, lift, and back. And my recommendation is do this up to 10 times as you progress to 3 sets of 10 on all of these exercises I showed you. Thanks again for watching me. I'm hoping you learned a lot about how to help your knee, your IT band syndrome or iliotibial band. Thanks again for watching. I'm hoping you learned a lot today. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, and Sundays for Pilates, yoga, physical therapy, and wellness advice. You can also follow me on my social media, my Facebook, Instagram, and Reddit. Evo! Have a great and healthier you. He's so excited. Bye!